Hi, this is Becky Oberd from the More Than Borderline blog at healthyplace.com, and today I'm going to talk about should borderline personality disorder be renamed. When borderline was first named, it was named borderline personality disorder because it was thought to be on the border of psychosis and neurosis. Later they thought it was a very borderline, for lack of a better term, form of schizophrenia. However, it's now known that borderline personality disorder is a personality disorder and possibly a form of post-traumatic stress disorder. So the name is misleading. As a result, many other psychiatric organizations have different names. According to the International Statistical Classification of Diseases and Related Health Problems, 10th revision, which is used by the World Health Organization of the United Nations, the disorder is defined as emotionally unstable personality disorder, considerably more accurate. The Chinese Society of Psychiatry has a disorder that's similar to BPD called impulsive personality disorder. Also quite accurate, but not all people with BPD are very impulsive. However, there can be a lack of judgment that can manifest as impulsivity. There is concern that the name borderline is stigmatizing, and as a person who has been in treatment for it for a long time, I would have to agree. I remember an incident at the Richmond State Hospital in Richmond, Indiana, where I told staff I felt suicidal, and they assumed that because I had the diagnosis of borderline, I was making it up to get attention. This ended very unhappily. However, is a name really the way to solve the problem? Not without training, but maybe a name is a good place to start. Some suggested names include emotional regulation disorder, emotional dysregulation disorder, impulse disorder, interpersonal regulatory disorder, and my favorite, post-traumatic personality disorganization. I think post-traumatic personality disorganization is the best way of saying this may be a form of post-traumatic stress disorder, and acknowledging that a lot of times our personality shatters after some form of trauma, and that's what manifests as our BPD symptoms. We shall see with the DSM-5 currently being written if borderline keeps its name or if it is changed. What do you think?